If you suffer from migraines or headaches, this video is for you. I'm here to guide you in finding and treating active points on your own ears so that you can find relief. Let's take a moment to figure out what kind of migraine or headache you suffer from. There are many possible causes, but let's focus on these three for now. Okay, the first is hormonal. So ask yourself, does your migraine or headache get worse with menstruation or ovulation? The second is neck tension. So are you a person that tends to clench your jaw, maybe grind your teeth, hold your shoulders up like this without really noticing? I mean, a lot of us do that, don't we? The third category is gallbladder related. This tends to be in people who worry a lot. And also, if your migraine or headache tends to happen between the hours of 11 at night and 1 in the morning, it's possible that you have what we would call a gallbladder migraine. But in the end, your ear is going to tell you which points to treat. I'm Dave Maybee, Director of the Canadian Institute of Auricular Medicine, and I invite you to join me in this ear stimulation session. Be sure to hit the subscribe button and the notification bell. Okay, now just before we go looking for points, grab yourself something like a golf tee, something that's pointy, not sharp. We don't want to break the skin. And remember, when we're looking for points, we're just touching lightly on the ear in different spots that I'll show you until we find something that is tender and feels a little bit more painful. Now, you don't have to dig in, you don't have to put a lot of pressure in order to find that point. But that tenderness that we feel is actually telling us that there's an active point there. And then that's when we're going to actually massage it for about a minute. Okay, let's get into it. For the gallbladder migraine, we're going to first look for the gallbladder point on the ear. Now we're going to look on the right ear because the gallbladder is actually on the right side of your body. And so the right ear reflects the right side of your body. Therefore, it's on the right ear. So first we're going to look where this ridge called the helix comes down into the lowest part, the deepest part of your ear called the concha. And where that meets is point 0. So we're going to find point 0. And then from there, we're just going to go up into the concha, into the upper concha. So right in the middle of that. And right in this area, if you poke around a little bit, you'll find an active point. And if you don't, then perhaps the gallbladder migraine is not what is going on for you. Perhaps the other kinds of migraine are more present for you. Okay, so poke around. And in this area here, you're going to find the gallbladder point. Once you find the point, it feels sharp, it feels tender, it feels a little bit painful. You don't need much pressure, remember, with the golf tee, and you can move it around a little bit without sliding on the skin, because if you slide on the skin, you might lose the point. And if it's very painful, you can even just keep it still. And if you like, what you can do is just pay attention to how it feels and the quality of the pain, the intensity of the pain, without changing your pressure. Just wait for the pain to dissipate just a little bit. And when the pain starts to change, starts to dissipate a little, then that's a sign that you can move on to another point. So that point's done for me. The next point we're going to look for is called the worry point. Now, this point is exactly where your earlobe attaches to your face. Okay, so it's actually pretty easy to find. So you're going to find the place where these two attach, and you're going to come right here. And you're going to find an active point, meaning a tender point. And once you find that, again, just moving the golf tee a little bit without sliding on the skin, finding that tender point, and just massaging it with the tip of the golf tee. Creating a little bit of pain, but not too much pain. just enough to actually stimulate the point. That's the worry point. Okay, now the other point that we're going to look for the gallbladder migraine is the eye point. And the eye point is active, of course, on both ears because you have an eye on either side. So you can look on the right or the left, or both if you like. Now the eye point is actually pretty easy to find because it's right in the center of the earlobe. So you take your earlobe, you can feel where it is, you can feel it, and then you're going to take your golf tee and go right in the middle. Okay, and you're going to find a point, an active point that's tender, and again, just massage it. Just massage it. You can go, 20 seconds if you like, or you can go from how it feels. Like I said, just wait until you get that real tender spot. And then keep it there, keep massaging until you feel a change in that tenderness and a change in that pain. Perhaps it dissipates a little bit. And that's how you can tell that you've treated the point. Now with the eye point, you can also go to the other ear. And again, find your earlobe, go to the center of the earlobe, find a tender point, and there it is. The eye point. Now this is especially important when you have a migraine around your eye or behind your eye. Even if you don't have a migraine that is a gallbladder type migraine, you can still find your eye points and treat them, and that should help release the tension and the pain there. I want to hear from you about your experience with this ear stimulation session. And don't forget to subscribe to our channel and join me for another ear stimulation session tomorrow as you take a moment to give back to yourself. You deserve it.